In today's training module, the topic we'll be discussing is preventing medical errors for nurses. There are two learning objectives that I want you to keep in mind prior and during this training module. So after the training module, students will become more aware of some of the medical errors that exist in the workplace and how they can implement strategies that can help reduce and recover from medical errors. The best way to help you understand this concept is through a presentation. I will be presenting 3 scenarios where there will be an interaction between doctor to nurse, and nurse to patient. In each scenario, students will learn how to identify different types of medical errors, and then after each segment, I will then address and describe strategies that nurses can implement to reduce them.
Hello, Dr. Blue.
Yeah, Nurse Red, what do you need?
I need a prescription authorization for patient Yellow. He was a patient you saw this morning with otitis media. As mentioned in this chart, it is noted here the prescription to prescribe him with 250 milligrams of amoxicillin. Is this correct?
Yeah, sure.
Thank you. I will send this over to the pharmacy right now.
After hearing that brief telephone conversation between Dr. Blue and Nurse Red, we can see that there are several medical errors on behalf of Nurse Red. There are a few medical errors that exist in this scenario. One is fragmented care error, which is the lack of communication between the prescribing physician and the nurse. The nurse breached her duty by not double checking and even triple checking with the doctor on the correct prescription drug and the dosage. The second medical error was prescribing error. The selection of the drug was not verified in correlation to the patient's allergies or other indications. So some of the solutions we can implement here is 5 rights of medication: the right patient, the right dosage, the right time, the right drug, and the right route. Also, have the doctor read back from the ordered medication to transcribe correctly. Double checking or even triple checking procedures to make sure that transcribing is correct on the physician's end and on the order and the medication administration record, or the MAR, or the treatment administration record.
Hey, Nurse Red.
Hey, Nurse Blue, how's it going?
Exhausted. My shift is finally over, so now I can go home and get some rest.
Lucky. My day's just getting started.
Oh, before I forget, here is the patient's White's report. He is currently being transferred from med-surg and going to ICU following his appendectomy surgery. His surgery was at 4 p.m. Oh shoot, I'm late again. I need to pick up my kids from school. If you have any questions, just call Nurse Purple, okay? I'll see you.
Okay. I'll see you soon.
Bye.
After hearing the scenario between Nurse Red and Nurse Blue, there are several medical errors that occurred from both nurses. We know that there's an exchange of communication from both nurses about taking over the responsibility of the report of the removal of the appendix of patient White. Similar to the first scenario, there was a lack of clarity and duty from both nurses. The first error we want to address is fragmented care error. Nurse Blue failed to inform the other nurse to monitor the patient when injecting morphine because the patient was lactive sensitive, which could result to developing further disease if injected with a plastic syringe. This can also be viewed as an improper administration technique error because since the patient was lactic sensitive, he may need the drug to be orally administered. Nurse Blue also failed to address when the patient was administering his first medication, thus could result Nurse Red administering it in the wrong time frame. This is considered wrong time error, in which the medication is given outside the predetermined interval from the scheduled time. The last error can be described as wrong dose error, which Nurse Blue failed to address how much of the dosage was required for the patient. So some of the solutions we have is, as mentioned earlier, ensure the 5 rights of medication, also follow proper medication reconciliation procedures. Lastly, another strategy to implement is to know the patient, know the players, and know the plan of care. So knowing the patient, the importance of knowing all aspects of the patient, including medical and medication history, not only to give the highest quality of care, but also to recognize errors. Knowing the patient mandated obtaining an accurate and comprehensive report from the transferring unit or at the time of shift. Second, know the players. Nurses sometimes use individualism approaches to depending on the team's members' personalities or preferences. You should know the coworkers instead of rushing off, and the nurses should be taking care and address any concerns and issues so there are no barriers where the new nurse can come in. Lastly, know the plan of care. Another important strategy for identifying errors is to know the plan of care or recognizing the lack of comprehensive plan. Reviewing the plan of care, for example, at the change of shift report or during the rounds help nurses find errors in the current plan. Perhaps the nurse could have taken a few minutes to help debrief the other nurse and review the current plan for the patient being traveled.
Hi, Mr. Keys. How are you doing today?
I'm feeling good. Feeling good. finally get to go home today.
Absolutely. You're surprised by your quick recovery, and Dr. Blue says because of that, you get to go home early. Before you leave, though, we need you to go over a few things in regards to the oral medication you will need to take daily following knee surgery.
Sure, that shouldn't be a problem.
Great. So first, you need to take one of each from the following bottles. Just follow the instructions on the label, and they will help minimize the pain. Do not hesitate to call the pharmacy should you have any questions. Please sign and date here.
It sounds easy enough, I guess.
Perfect. Thank you, and have a great day.
So in our last scenario, we have an interaction between the nurse and the patient. The patient is being discharged from the hospital following a knee procedure. There are several medical errors to address here on behalf of the nurse. To begin, the nurse failed to address each prescription drug and that the patient will be taking. Each drug has its own specifications such as dosage and the time of day to be orally taken. The nurses need to make sure that the patients know the names of the medications they are taking, what they look like, what they are for, how to take them, and how will they be administered, the dosage, and the potential side effects and interactions. Here we witness again fragmented care error. Following the release of prescription drugs to the patient, the nurse failed to address the confusion the patient had. Not only did the individual understand or not, the individual needs to understand and know what they're taking. The nurses should have the patient reread and go over each drug name to clarify what it was. It will also allow the patient to gain a better understanding on what exactly they'll be taking. Lastly, the nurse has the patient sign and date the documents of acknowledgement. This is an error on the nurse because he or she did not properly disclose all the necessary information that he or she should have. So some of the solutions we can take a look at is learn the institution's medication administration procedures, policies, regulations, and guidelines. The policies and procedures contain vital information regarding medication ordering, transcription, administration, and documentation. Also consider having a drug guide available at all times. This guide can help give the patient give more information about the trade and generic name, drug-to-drug interactions, side effects, adverse reactions, and more about being properly informed personally by the nurse. So after viewing and listening to the 3 case scenarios, I'm hopeful that I will provide you with some basic understanding on how each nurses are exposed to situations that may be prone to mistakes and errors. Thus, nurses need to be aware of these types of situations and how they can use strategies to help them minimize these medical errors from happening.